My name is Andy Lane, and I'm a professor in the Department of Otolaryngology, Head and Neck Surgery. My other title is the director of the Johns Hopkins Sinus Center and the head of the Division of Rhinology and Sinus Surgery. I came to Johns Hopkins in 2001. I have developed a practice that's really centered mostly on minimally invasive endoscopic surgery for patients with sinus problems. My practice has really become very focused on patients who've had long-standing sinus diseases that have not responded to previous therapy. And so I see patients from around the region and across the country who come for some specialized care and hopefully a higher level of care. We also specialize in the treatment of other types of conditions in the nose, such as tumors, and I work with my colleagues in ophthalmology to perform some procedures of the eye that we can now perform through the nasal passages. Another important role I have here is that I direct a lab, a research lab, where we study the causes of sinusitis, and this is an NIH-funded lab that is making a lot of advances that we hope will lead to new therapies. I chose rhinology as a field maybe for three main reasons. First, the anatomy of the sinuses is very complex and interesting. It's variable from person to person, and there's a real challenge to operating using high-tech equipment in a very confined space with a great deal of precision. The second reason why I got interested in rhinology is that despite the fact that this is a very, very prevalent disease that affects many people, it's surprising how little is really known about what causes sinusitis. And the opportunity to do research and bring my skills in the lab together with my clinical skills to try to advance the field forward and hopefully have an impact in developing new therapies was something that really brought me to rhinology. And then last, again, given how this disease can be very debilitating and affect patients' quality of life, there's a lot of satisfaction that I derive from being able to see a patient who's failed medical therapy or surgical therapy over a period of time and then makes their way to me, and we can do something to improve their quality of life on a day-to-day basis and improve their well-being. And that's something that on a daily basis really gives me a lot of satisfaction.